to do a little something like this right here.
So what is pulmonary edema? Pulmonary edema is a condition of excess fluid within the lung that is most frequently caused by a backup in pulmonary circulation and is commonly associated with congestive heart failure. This fluid collects in the many air sacs in the lungs, making it difficult to breathe. Pulmonary edema that develops suddenly is a medical emergency that needs immediate care. Pulmonary edema is seen on chest radiographs as a diffuse increase in radio density in the hilar regions fading towards the periphery of the lung and as increased air fluid levels with the horizontal beam projections in most severe conditions. The causes of pulmonary edema are as follows. Heart conditions, namely coronary artery disease, in which blood flow to the heart muscle is restricted. Coronary artery disease weakens the heart and results in inadequate pulmonary circulation, causing backup of blood in the lungs. Other heart conditions that can cause pulmonary edema include congestive heart failure, arrhythmia, and heart valve problems. All of these heart conditions may prevent blood from being propelled forward properly. This can contribute to the buildup of pressure and pooling of blood within the heart's left ventricle, causing too much fluid to leak into the lungs. Heart attack, stroke, and injuries to the lungs, including pneumonia, kidneys, including kidney failure, or liver, may also contribute to the increased pressure within the heart, leading to excess fluid in the lungs. Other factors, such as being at a higher altitude than one is accustomed to, especially if there is physical exertion or taking certain medications, can also lead to pulmonary edema. Tests that can help diagnose pulmonary edema or determine the reason for fluid in the lungs include a chest x-ray, which can confirm the diagnosis of pulmonary edema and exclude other possible causes of shortness of breath. It's usually the first test done when a healthcare provider suspects pulmonary edema. A chest computed tomography, or CT scan, gives more details about the condition of the lungs. It can help a provider diagnose or rule out pulmonary edema. Other tests include pulse oximetry, arterial blood gas test, B-type natriuretic peptide BNP blood test, other blood tests, electrocardiogram, ECG or EKG, echocardiogram, cardiac catheterization and coronary angiogram, or an ultrasound of the lungs. The possible radiograph appearance, as previously stated, is an increased diffuse radiodensity in hilar regions. The most common radiographic examination to diagnose pulmonary edema is a PA in lateral chest and a horizontal beam projection for air fluid levels. You will want to increase your exposure factors in severe cases of pulmonary edema. Shown here is an example of how a radiologist would identify pulmonary edema. Symptoms of pulmonary edema are trouble breathing or shortness of breath, feelings of anxiety related to breathing difficulties, wheezing or noisy breathing, quick, shallow breathing, trouble breathing while lying down, discomfort related to breathing, a feeling of suffocation, coughed up blood, pale or bluish skin, sweating or feeling clammy, swelling in the feet or ankles, and confusion. Pulmonary edema tends to affect older adults, particularly those with heart failure. Up to 80% of people with heart failure also have pulmonary edema. Men are affected more often than women. Although some people without heart disease experience this condition, most cases of pulmonary edema are linked to heart problems. The risk increases among people with heart conditions who do not take their medication as prescribed and don't follow their doctor's nutrition advice. People who are at an increased risk of pulmonary edema include those with congestive heart failure, heart valve problems, which leads to backward blood flow within the heart, irregular heartbeat, high blood pressure, heart attack, stroke, pneumonia, liver disease, kidney disease or injury, lung injury, and additionally, visiting destinations at high elevations may all increase the risk of pulmonary edema. Pulmonary edema can be life-threatening. People who are diagnosed with the condition may already be in heart failure, or they may have had a heart attack or stroke. Other chronic health conditions may complicate their care. People who seek treatment may recover, but about 20% of people who are treated for pulmonary edema die, often due to complications. Among those who do recover, the lungs usually function normally again after 6 months or a year, if not sooner. Common treatments for pulmonary edema include supplemental oxygen, which may be delivered through a nasal canal, medications including diuretics to rid the body of excess fluid, nitroglycerin to help lower pressure within the heart, inotropes to help the heart pump more efficiently, and/or ACE inhibitors to manage blood pressure levels, morphine, which can help reduce anxiety and improve breathing, continuous positive airway pressure, CPAP, another method to improve breathing, ventilators, which require intubation, may improve breathing when other methods are unsuccessful, and renal replacement therapy when pulmonary edema causes kidney failure. This condition is very common. More than 1 million patients are admitted each year with a diagnosis of pulmonary edema. In dealing with pulmonary edema, self-care includes keeping blood pressure under control, managing other medical conditions, avoiding the cause of your condition, not smoking, eating less salt, choosing a healthy diet, managing your weight, and getting regular exercise.